Good morning and Happy New Year. Welcome to the Greater St. Louis MGMA's January 2023 webinar. Before we get started, we have a couple of quick housekeeping items. All webinar attendees will be in a listen-only mode. The chat feature will be used to take any questions, so please feel free to submit your questions at any time during the presentation by clicking on the chat icon at the bottom of your screen. Questions will be addressed at the end of the speaker's formal remarks. And as questions are being presented, we will unmute the individual that is asking the question just so we can get the accuracy down. Today's webinar is being recorded, and a copy of the recording and any available slides will be posted on our website under the online education section of your member center. Thank you again for joining us for the January 2023 webinar entitled Cybersecurity in the Medical Practice: What the Current Climate of Cybersecurity Attacks Can Mean for the Medical Practice, presented by Kyle Haubrich with Sandberg and Phoenix. I'm going to now turn the controls over to Kyle.
Right. Good afternoon, everyone. Hopefully everybody can hear me. I was supposed to do this back earlier this year, but ended up last year, but ended up getting sick and had to reschedule. So hopefully the information that I have to provide to you today is new and you all pick up something from it. Again, just as a reminder, remember your questions as we go through this, and then at the end I'll open it up for questions, and we will unmute you so you can ask your questions. All right. So the discussion points today that we'll go over is, what is cybersecurity? How does HIPAA and cybersecurity go together? Current cybersecurity climate and recent attacks. And then again, we will open it up for any questions. All right, cybersecurity in healthcare is the protecting of electronic information and assets from unauthorized access, use, and disclosure. So all of you that are on electronic medical record systems, that is your cybersecurity hub. So if eClinical Works or Epic or somebody like that gets a ransomware attack, you could be part of that and be unable to access your medical information. All right. There are three goals of cybersecurity: protecting the confidentiality, integrity, and availability of information. So you are required to ensure that patient information is kept confidential, that you're only using or disclosing it in a manner that the law allows. The integrity, that basically that the information you have is accurate, that no one's gotten in there that's either authorized or unauthorized and has started to mess with the medical record, making it so that it's not accurate. And then the availability. So that's not just availability to your staff and to you to use that information, that's part of it, but it's also availability to the patient themselves to be able to access their medical records, or whoever the patient has authorized to have access to their medical records. All right, big key here. Compliance versus security. When it comes to cybersecurity, compliance is not security. All right, what people get confused is you could have a great compliance program for, say, HIPAA, and you know your staff is in full compliance, but you may have, because of that, there may be, and usually is, security measures that aren't being met. Okay. We'll go over this in another slide here in a little bit, but on the security side as well, you could have a fantastic IT security system in place, but be completely out of compliance in certain areas. And so it's key to understand that in cybersecurity, compliance is not security, and security is not necessarily compliance. All right. So compliance and security activities have two specific and different objectives. Compliance is really regulatory compliance. Are you complying with the law? Are you doing what the law is requiring you to do? As you can see on the screen, regulatory compliance is defined, and I've given that definition of how they define it. But regulatory compliance has a particular focus, which means that merely being compliant with these standards, like we talked about, might leave valuable information assets vulnerable. Now, when it comes to cybersecurity, again, security is not compliance. Focusing exclusively on security is not enough to meet the standards required by various regulations. Implementing strict security standards will generally not make your organization compliant with regulations. So, for example, if you have the two-factor authentication system set up so that when your staff logs in to the system to bill under the United Healthcare for the services you're providing, it may pick a temporary one-time code to that individual's cell phone that they then have to type into the system as the second form in order to get logged in. Well, that's great. That probably meets the security standards of keeping things protected. But if you haven't trained your staff on how to, say, handle the HIPAA requirements that go along with that, then you could be out of compliance, but fully protected security wise. So cybersecurity is very interwoven in making sure that you're not only secure, but that you're also meeting all the legal requirements. When it comes to a complete cybersecurity program, you have to address all of your practice information assets. So what all could be considered information assets? Well, that could be computer, laptop, tablet, cell phones. Sometimes even the phone system can be considered information assets. And you have to address what kind of potential vulnerabilities you might have. So you're going to sit down with maybe the other doctors, other staff members, and you're going to sit down and you're going to try and figure out what possible attacks could we face, not what attacks have we faced. That's a different question. What possible attacks could we face? What happens if we get hit with a ransomware attack? And the type of ransomware attack we get hit with is basically the equivalent of a full chain locking up the file cabinet, per se, to where we can't get the records out, but no records have been disclosed. They haven't been taken by whoever did the ransomware attack. They basically just locked it down. What do we do? How do we handle that? So that's what you're wanting to do to make sure that you're addressing any potential vulnerabilities, and also any potential threats. All right. So the cybersecurity program has several elements. I've listed all of those here. You have the written policies and procedures, extensive workforce training. We usually recommend with the healthcare compliance program that I do for my clients, we recommend trainings at least 4 times a year, once a quarter. But then any new employees need to be trained. Anytime an employee violates HIPAA or makes some mistake that might cause vulnerability to patient information, they would need to be retrained again. But for established employees, we make sure that they're getting trained at least once a quarter to make sure that they're always up on anything new to HIPAA, that they remember what responsibilities they have to do with the different compliance laws. And so you want to make sure you have that extensive workforce training. Assessments and analysis, you want to constantly be looking and making sure that you've closed gaps, any cybersecurity gaps that you might have, as well as the ones that you know were closed. You want to make sure that they are continuing to be closed. Auditing and testing, when it comes to this, it's basically running an audit trail to see who has access to your patient information. This can be done. Usually your EHR systems will allow you to do it. Now, when you get it, you want to make sure that you limit it to a single day and a certain time frame, because if you just do, say, the month of January, you could have a 2,000-page audit trail and it might take you forever to go through it. But if you kind of restrict it to a certain time, just random time, random day, then it's a lot easier to go through. And what you're looking for in that instance is the usernames that are showing up, any kind of access point of someone that access. You want to match those to your employees' usernames and passwords just to make sure that they're the one accessing it. And then any one of those that don't match up, you'd circle that and basically go back to the EHR company and say, did anybody on your end access it that we weren't aware of? Yes. Okay, that's great. If not, then that's potentially you've potentially been accessed by someone who shouldn't have accessed. Okay. Regular activity reviews, that's the audit trail again. And then incident response plans. These are your contingency plans, what to do if, power goes out, what to do if you have tornado or earthquake and it causes all kinds of problems. You have to have those plans in place on how you're going to see patients, how you're going to protect patient information, and all that has to be planned out. Risk management plans. This is what you're going to do to mitigate the risks. We'll go over those plans as well. All these plans should be written in as much detail as possible. Well, that is what CMS says when it comes to this. That's what HIPAA says. But what we have found in practice is that, yes, have it in as much detail as possible, but open-ended as well, because you want to make it so that you have the practice and the physicians and different staff members, as they're going through it, have the ability to adjust to changing circumstances without having to go back and literally rewrite your entire manual every month or every quarter. And so you write it in as much detail as you can, but you do it in a way that allows you flexibility. All right. The teams that help you put all that together, they need to be trained and understand what their roles are. You should test your plans on a regular basis. What I usually tell my clients is the office manager and the doctors are the only ones that should know when you're going to do a random cybersecurity incident, not the staff. And then on that specific day that you've picked, do the fake cybersecurity incident and see what happens, see what your staff can do. And then with that knowledge, adjust your plans and adjust your trainings to make sure that in the future, when you do these random testing, that the staff actually performs better. Because you do not want your first test of a disaster recovery and business issue to be in the middle of a crisis. Okay. All right. Common language when it comes to cybersecurity. Extremely important to be sure everyone understands the requirements properly and what you're trying to get across. All right. HIPAA lays out, for example, and defines a specific glossary of terms, things like security risk analysis, privacy rule, security rule, breach notification rule, what the different exceptions are. Well, if somebody is hired on in your practice that's never worked in healthcare before and is going to be, maybe a front desk person, their definition of what privacy is may be different than what you and the established staff know it to be in your practice. So you want to make sure that all the terms are defined and that the staff is trained on exactly what you mean, not necessarily what they may think it is. All right. Okay, we're getting into the information and security frameworks. Think of these as the blueprints for a building. You're gonna, you need the blueprints in order to build that brand new building, build that brand new office space. That's what these frameworks, cybersecurity frameworks are. They're the building blocks of putting this all together to ensure that your staff, your medical record information, patient information is all secure and accurate. And so these are the building blocks that help you maintain that. All right. Information governance refers to a holistic approach to managing practice information. Practice that uses this will analyze information throughout the whole practice instead of just the information covered by compliance programs. So like we said, you could be fully compliant with the law and have security gaps, or you could be completely covered and have no gaps security wise, but you're out of compliance with the different laws. I could really throw a curveball at you and say that when it comes to macro-MIPS as well, you could be fully compliant with macro-MIPS and not compliant with HIPAA, but also secure with macro-MIPS and not secure with HIPAA. And so the different laws can cause problems, security issues can cause problems. So it's really a complete picture, full picture type way to handle it when it comes to cybersecurity. You need to think of all the different things. All right. The effectively implement a cybersecurity program that addresses both security and compliance, you must understand all of the information is valuable. All of your information is valuable, and strategic assets should be treated accordingly. So knowing that everything in your practice has value, and you have to protect it all, that should be your focus when you go to do these cybersecurity plans. All right. The National Institute of Standards and Technology Cybersecurity Framework, NIST CSF, for example, is the path forward as it improves security beyond the HIPAA security rule. Okay. So 5 core components to this framework: identify, protect, detect, respond, and recovery. All right. First one is identify. Identify involves finding and listing your information assets, threats, vulnerability, level of risk, and current protections in place. Think your HIPAA security risk analysis, that 168, 200 question questionnaire that you fill out every year to know if you've got all the right policies and procedures in place. Is everything encrypted that should be encrypted? Are the passwords changed every so often? All that stuff. When you fill out those questionnaires, that's your security risk analysis. That's your security risk analysis. All right. Protect. Protect defines the protections put in place to secure information based on the data already gathered. Think encryption, two-factor authentication, things like that. So you're encrypting your data to protect it. You have that two-factor authentication, like we talked about, that protects your data as well. Detect. Detect describes the methods that are put in place to monitor systems and information to ensure protections are working and to detect any potential security issues. With this, think antivirus protection, anti-ransomware, anti-malware, stuff like that. That's your software that's going to detect anybody trying to access your information that shouldn't be. All right. So respond. Respond defines the activities to be undertaken if problems are detected. Think disaster recovery, emergency mode, and other plans that make up your contingency plan. That's what this is. How are you going to respond when something happens? And then recovery. This is the same as the plans on the last side, but specifically what this is the steps you're going to take to get your practice back up and running and back to normal workflow again. You know, what has to be turned on first, what has to be secured first, second, third, fourth, on down the line. Most practices will say that the EHR system has to be set up and the power back on first, and then phones on down the line so that you can get back to normal workflow. So that's what recovery is. All right. There are 2 profiles to complete this NIST CSF process. The first one is the current profile. It identifies the cybersecurity outcomes that are currently being achieved by the practice. So what you're currently doing, because when I go in and do a security risk analysis for a client, what I say is, look at all the good stuff you're already doing. Now let's look at the stuff that needs to be addressed. And I guarantee you, most of the time, the stuff you're already doing, that list is usually longer than the stuff that you need to address. Okay. And then the second is the target profile. So you've figured out what you have to address. Now, how are you going to address it? For example, I've had clients that have called and said, hey, we just don't have the money to replace the 6 computers that we need to replace. We can't replace them all at once. We know that they're not compliant anymore, but we can't replace them all at once. So what we would do in that instance is I would write a policy and a procedure in place that would allow them to rotate out 2 computers every year for new ones. And then we would draft a policy and procedure on what the practice plans to do to secure the medical information on the computers that they can't replace yet. And then once all 6 in this example have been replaced and are compliant, then that policy, while it's still there, just isn't implemented because it's at that point it wouldn't be implemented because all of the computers at that point would be fully compliant. All right, risk management. This means that before making decisions about business plans and activities, you identify potential risks, assess what should be done about those risks, and set priorities. So you've done your security risk analysis, you know what you have to address. As you go through and address it, you have to figure out, okay, I've got 15 things I have to address, but 5 are considered high risk. Let's focus on those 5 right now. And then in 6 months, we'll circle back and address the ones that are kind of medium risk. And then after another maybe 3 months after that, we'll make sure that the high risk ones, the gaps were getting closed and they're not high risk anymore. And then, kind of going through that process of making sure that everything is in place to address those risks. Now, cybersecurity defines risk as the likelihood multiplied by impact. As risk grows as either likelihood or impact increase. So the likelihood that something could happen, ransomware attack, then your risk goes up. If the impact of the fact that you don't have, say, antivirus software on your computers and could end up having cybersecurity attacks, that would be a major impact to your practice, then obviously the risk goes up. So again, likelihood or impact increase as risk grows. All right. Effective security and risk management elements. You must, but requires it now for sure, must devote regular resources regularly in order to defend against all potential risks they are not, you personally and the practice are not willing to tolerate. There may be some risks that you're willing to tolerate and willing to roll the dice on. If that's the case, that's fine. You just draft your policies and procedures to explain why you're willing to tolerate that specific risk. If you're not willing to tolerate it, that's where you have to make sure that you've got policies and procedures in place. You've trained your staff on exactly how to implement those and that they're implementing them so that you can remove the risks you aren't willing to tolerate. All right, so risk management is a part of every process in your practice at every level. You must think all the time that question is what I'm doing on this computer, iPad, laptop, etc., going to cause potential data to become unsecure or vulnerable and cause major impact to the practice. If it is, don't do it. If it's not, then you would obviously be able to continue doing what it is that you're doing. All right. This is a big key. I find this a lot. This next bullet point. Every person in the practice from the front desk to the back office must buy into your cybersecurity plan and what's being trained on and implemented, because you can't just have the cybersecurity team buying in, or you can't just have the front desk buying in. You got to have everybody buying into it, because if they don't, then you could have the best security and compliance program combined ever, but because the nurses don't want to do it, or the doctors are frustrated with it and they don't want to do it, it's not going to be worth much. You're not going to be able to protect the data and your assets as well as you would need to. All right. Okay. There are several ways to manage risk at your practice. Each practice is different, so the best way to manage risk for one practice may not be the best way for another. I do have a few clients that are still paper-based charts. So security and managing risk is limiting the number of people who have keys to the filing cabinets, making sure the filing cabinets are all locked up at the end of the day, things like that. The practices that have EHR systems, it's a matter of making sure passwords really are changed every 90 days, that you don't have staff, for example, writing their password, username and password on a sticky note and putting it on the computer for everybody to see. That would be a major, not only HIPAA violation, but a major risk. All right. So managing risk options, there are two. You could avoid the threat completely, which really isn't possible to avoid it completely. But let's say that you could, then what ends up happening is some of the things that you need to do, you may not now be able to do it because you need to avoid, you're trying to avoid that risk altogether. Or you could accept the threat as a necessary element for your objectives and make dealing with it part of every plan your practice makes. So if you know, for example, that your staff isn't the best at remembering passwords, maybe there's a way that you could keep those passwords typed up on an Excel spreadsheet that you as the office manager lock up and keep encrypted, But then if the staff forgets it, instead of having to put in a whole new password, you just log into that encrypted Excel spreadsheet and say your password is X, and then they're in. That's one way to potentially accept the risk, but not have to avoid it completely of the fact that your staff may not be the best at remembering passwords. All right. You could remove the opportunity for the threat to have an impact on your practice. Making a few changes may eliminate the risk. In my last example, this would be that encrypted Excel spreadsheet of your employees' passwords so that you have it available in case they can't remember their passwords. Limit the likelihood that the event can occur. So if you have a practice that is in an area where crime has increased, maybe this one of limiting the likelihood that an event can occur requires you changing the locks so that they're not only key locked, but maybe keypad locked as well. So, it makes it harder for somebody to try and break into the office. You could change the consequences of the event's effect on your practice. Switch from being the easiest one that I can think of is switch from being a strictly all paper chart practice to signing up and getting involved with the EHR systems and doing it that way, because most EHR systems, in fact, all of them encrypt the patient data. And since it's encrypted, it makes it so that that's now protection for you and your practice. You can outsource the risk with external sources. This is what I deal with every day. Every client that signs up, they're basically outsourcing the risk as much as they can to me to help them ensure that their information is protected. You could also do this by outsourcing your IT, not doing your IT work in-house, but instead hiring a third party to do it. And that would allow you to outsource some of the risk to them. Or you could accept the risk with full understanding of the implications. I know my practice has a tough time remembering their passwords, but I don't feel comfortable having a encrypted Excel spreadsheet of all the passwords. And so we're just going to accept it, and they're just going to have to go through and keep clicking on the forgotten password link and change their passwords all the time. If that's the case, then, and you're fine with it, that's fine. You just have to ensure that you are willing and able to accept the risk of having those issues present themselves. All right. So on a day-to-day basis, managing risk will probably drift to the back of your mind. I know it does for me when I go home from work. I'm ready to not have to focus on it. I'm sure you guys are too. So it will drift to the back of your mind. So that's why you want to consider the potential impact of risks you decide you can tolerate now. And you want to make sure that you're doing these security risk analysis, you're doing these auditings, different things like that to ensure that everything is as protected as you can get it, so that when it does drift to the back of your mind, you know that everything is still protected as much as it can be. All right, identifying your team. One person cannot implement nor manage all the security program requirements for a medical practice. Let me repeat that. One person cannot implement nor manage all the security program requirements for a medical practice. It requires a team, office manager, front desk, medical assistants, doctors, the IT person in-house or that you've outsourced to, your regulatory attorney if you have one. All those people need to be part of the team and working through making sure everything is in place to fully protect, and that you are implementing it, you are being trained on it so that everything can be as protected as possible, because one person cannot do everything. Now, the size of these teams will depend on the size of the practice. Obviously, the bigger the practice, the bigger the team. SSM, for example, doesn't have a 3-man team. It's probably a lot larger than that. In fact, I know it is. But the one doc optometry practice down the street, their team is probably a 3-man team because of the size of the practice. All right. Listed there under that third bullet point are all the teams need to include certain elements. All the elements are there. Let's focus on the last one. The last one is educate, educate, educate. basically your training. What I have seen in my 10 plus years of doing cybersecurity and compliance training in the health field is that one person in the practice will figure out all the answers to the HIPAA test, for example, and then pass out all those answers to all the staff members so that everybody passes the HIPAA test. Well, that means that maybe one person in the practice knows how to respond to HIPAA situations and incidents. So what this means when we come to training is don't do quizzes and tests. Instead, come up with scenarios, different scenarios, and go through those scenarios with your staff and say, okay, this is what has happened. What do we do in order to make sure that this doesn't happen again? What could we do to make sure that it doesn't happen at all? And make them implement and apply the policies and procedures that you've trained them on. Okay. That is the best way to train, because basically, not only are you going to pick it up because you're teaching the staff on how to comply, the staff is going to pick it up better. And you'll actually notice, I noticed this one time on a practice that was doing the test situation and then switched to the scenario based one with us. And I was sitting waiting for to start the next round of training, and I heard one of the front desk people talking to a patient, and the patient on the other end of the line, the mother of the patient on the other end of the line was telling the individual, hey, my husband and I are divorced. I don't want dad to have the information on my son. And without even thinking about it, the front desk person said, that's fine. We need a copy of the divorce decree to ensure that that's the case, that he can't have access. We need an authorization from you to indicate that that's the case as well. So we have all of the documentation so that if he calls, we can say, this is why you can't have it. And it was because we had gone over these different scenarios, and the individual just second nature, boom. That's how you protect your practice when it comes to cybersecurity. All right. Remember, it is virtually impossible to protect everything all the time. For any of you that have kids like I do, when my wife and I had our first kid, we tried to protect him from everything all of the time. It's impossible. We realized that right away. Okay. It's the same with this. It's virtually impossible to protect all of your assets and all of the patient data all of the time, but you can put things in place that help you with that. Encryption, making sure your staff's trained, all those different things. Okay. All right. So that brings us to HIPAA and cybersecurity. Privacy rule. Privacy rule definition under HIPAA is: the rule requires appropriate safeguards to protect the privacy of protected health information and sets limits and conditions on the uses and disclosures that may be made of such information without an individual's authorization. All right. Security rule is basically the same thing, only it's requiring you to protect the patient's electronically stored patient data. All right. So whether you are paper chart practice or EHR practice, you have to comply with the privacy rule. If you are paper-based only, security rule, there's a lot of the stuff in the security rule that you don't have to comply with because you don't have electronic medical records. Okay. But everybody has to comply with the privacy rule part. All right. Perform periodic risk assessments. These are your security risk analysis. Make sure that you have executed business associated agreements with all of your vendors that come in contact with your patient data. Okay. That's key. They have to come in contact as part of what they're doing for you with your patient data on a regular basis. So your EHR systems, your billing systems, any third-party group that's going to access your patient data in order to provide services to your patients. Now, I get the question all the time of, do we need to sign a business agreement with our cleaning vendor that cleans our office? And the answer is no, you do not, because it's not part of their routine work to come in contact with your patient data. So you would not need to sign a business associate agreement with them. All right. And then the breach notification rule has to do with a breach that's occurred where your patient data has been basically illegally accessed. What do you do If the amount has been that has been accessed is 500 or more patients that were or could have been affected by the breach, then you have no more than 60 days from the date of the breach to report. I always have my clients report within 30 days to HHS, OIG, that's the Office of Inspector General, of the breach. We do it within 30 days. If it's less than 500, then you only have to report once a year and it's at the end of the year. So I've had clients that have called and said, we have these 2 patients where we gave the lab results to the wrong patient. It came back. Obviously, it was a breach. It was a mistake on our part. Do we have to report it? The answer is yes, but you report them once a year. And we set it so that we report it in December for all of the clients that had a breach of less than 500. All right. So those are the definitions. Top security cyber threats in healthcare, email phishing attacks. These have to do with, oh, this email looks good. It has to do with Cardinal baseball. Let me click on it. And you click on it, and all of a sudden, some third party now has complete control of your system. All right. So you want to make sure with those email phishing attacks, you want to make sure that the email you're looking at is the one that you were expecting. Okay. Ransomware attacks. We've gone over loss or theft of equipment or data. So I have practices where the employees will take home the laptop with them to work on different things, charting, billing, whatever, that they didn't get done during the day. They'll take a laptop home with them. Well, if it gets stolen out of their car, now you've got a data issue. Insider, accidental or intentional data loss. You have an employee that is getting terminated. They get tipped off. They grab patient data and run out the door with it. That's that one. And then attacks against connected medical devices that may affect patient safety. If you only have one internet Wi-Fi connection and you don't have it locked and anyone can connect their personal phone to it, then that's what this is. You're basically getting attacked from somebody who's using your free Wi-Fi. All right. Okay. Under email phishing attacks, cyber criminals attempt to trick you into giving access, downloading malicious software. They may obtain your email from publicly available sources, identify contacts through publicly available sources and social media, send you email that appears to be from a known contact. You know, maybe you get an email from Kyle@gmail.com. Well, you're like, I'm expecting an email from Kyle. Maybe that's the right one. Boom. And now you've gotten attacked. Okay. So what you want to do is if it's from somebody that you're expecting an email from, but you have never gotten an email from them before, you want to make sure that you've got the right email written down so that when you see it, you can match it and make sure that it's correct. And then you can click on it. So that's one step that you can take. Email usually contains an active link that solicits sensitive information or downloads malicious software. We've all gotten those spam emails that say, click on this link for a chance to win $10,000. All right, so you click on it and boom, now that software is on your phone, it's on your computer, and they've gotten username and passwords to your bank accounts and other systems that you have on there, and now you're pretty much up a creek. And then some attacks can be very convincing. It can look like it's totally legit. For a while there, a few years ago, there was ransomware attacks and malware attacks with email phishing, where it looked like you were getting audited by the IRS. Everybody freaks out. Well, let me tell you right now, the IRS will not email you. You always get a letter in the mail. In fact, they say on their website that they will not email you if they are going to audit you. And so you, if you get an email saying you're being audited, you know to delete it right away. All right. Again, questions to ask yourself when you're seeing email you may not know or recognize. Do you know the sender? Did you expect the email? Is the subject generic? Are there spelling, grammar, or other indicators? Does the email require you to take some action? Did you hover over the link to see the URL destination? All those different things. All right. Practice to consider. Be suspicious of emails you don't know. Be suspicious of emails that appear to be from known senders. Train staff to recognize suspicious emails. Never open attachments from unknown senders. Tag external emails to make them recognizable to staff. All that kind of stuff can help you protect your data. Ransomware attacks. This is where they're trying to either lock down your medical information, but they're not taking it from you. It's just locked down, and they want you to pay a certain amount for them to give you the code to unlock it. Or the other type of ransomware attack is they really are taking the data from you, and they refuse to give you the copies of the data they've made back until you pay the ransomware, the ransom amount. FBI says that you should not pay these ransomware ransomware demands, because there's no guarantee that paying ransom will allow you to recover data. And even if they were to give you the data back, there's no guarantee that they didn't make multiple copies. You know, they may give you one copy of it, but they made 3 copies. So that's why they tell you not to pay these ransom requests. Again, practice to consider pretty much the same. Train staff, make sure anything that looks suspicious is addressed, different things like that. All right, loss or theft. Be aware of unsecured or unencrypted equipment. If you have staff that takes that laptop home, make it so that when if it were to be stolen, make the equipment encrypted with that 2-factor authentication, so that even if I were to steal your laptop, for example, I wouldn't be able to get into any of the systems where you have patient data. All right. Again, same thing, encrypt sensitive data, train staff, use secure server, all that kind of stuff. Questions are pretty much the same. Does my equipment contain confidential or sensitive information? Answer would be yes, if you're taking it out of the practice. Is the device secure? Is the information encrypted? All those different fun things. All right. Insider, accidental, or intentional data loss. Common vulnerabilities are files emailed to the wrong address, inadequate monitoring, tracking, and auditing, inadequate physical access control. This is basically patient asks you to email them a copy of their medical records. You say, okay, you get online, you email them the medical records to what you thought was the correct email. You forgot one of the letters in the email address, and now you've sent the medical records to the wrong individual. That's what this is. Okay. All right. So the current cybersecurity climate last year, just the first half of last year, there were 337 breaches, affecting more than 19 million records. The total cost of a data breach is around 10.1 million per incident, signifying a 9.4% increase from 2021. The top 10 biggest healthcare data breaches, which we'll go over on the next slide. And then the majority of breaches on the next slide stem from third-party vendors. All right. So here are the top 10. First one touch point. Reported a breach to OCR that impacted more than 2.6 million individuals. Had to do with access by unauthorized third party. Eye care leaders, same deal. 2 million affected, and it was because of that one was email phishing. And then Shields Healthcare Group, this one had to do with inappropriate network access from third party that affected another 2 million. Okay. Now, with all of these that we're going over, these are large groups, and I'm going to skip ahead here to get to this. Point here is that while all of these are larger medical organizations, your SSMs, your Mercies of the world, they have paid staff that are specifically hired to protect data, to ensure that you're in compliance, to ensure as much as possible that security incidents are addressed and taken care of. They're still getting attacked. They're still having security incidents. Think of your practice. If it's a 1 doc, 2 doc, 3 doc practice, you're not going to necessarily have a paid team where everyone is focusing on it all the time, and that's their job, is to focus on it. You're going to have an office manager and some of the staff focusing on it. So if the big boys are getting hit, you're going to get hit too. And lately we've been dealing with a lot of smaller practices getting hit with ransomware and other security incidents, because To a hacker, what I've been told by the FBI is to a hacker, the smaller practices are low hanging fruit, really easy to lock that down and then say, pay me $10,000, I'll give you the keys so that you can get into your medical records again. And so it's easier for them to get a smaller practice to pay or be locked down than it would be for them to necessarily get one of the bigger groups locked down. Any questions on anything that we have gone over? Anybody still
Maybe
alive?
use the chat section. I'll give it a couple minutes just to make sure nobody had any questions. And I can just, if you just want to type your name in the message, I'll just call on you. Okay, so Stacy, if you want to go ahead and unmute yourself, you have a question if you have no plan in place.
Yeah, thanks. This was a really good presentation. Thank you for giving us all these scary things to think about. For practices that don't have like a formal plan in place, what would a good first step be?
So the first step that I always have my clients do when they first come on is you can download the security risk analysis from HHS, and that's what I would recommend first is going through all those questions first, determining where that'll help you determine where your gaps are, things like that. And then using that information, you can then begin to draft your policies and procedures, draft your plans from that information you obtained. So I would say the first step, if you don't have anything in place at all, is to start with that security risk analysis to see where you are compliant, where you're not, and then draft the policies and procedures based off that information so that you can then begin to keep those gaps closed that are already closed and have a process beginning to develop on how to close the gaps that you do have.
Nothing else that can at least give you a roadmap, tell you where to go.
That's right. Yep.
Perfect. Thank you.
Mm-hmm.
Okay, Matt Lynch, if you would like to unmute regarding your question about what your options are regarding FBI saying don't pay.
Yeah. Thanks, Courtney. Kyle, my name is Matt Lynch, and I had a question. You said the FBI advises not to pay. What are the options? For example, maybe somebody has insurance to pay, but that's still paying. What do you suggest in those situations?
So what the FBI will tell you and what we've done in practice is if it is locked down and they're asking you to pay, then what we would do is the first thing you want to do once you know you've been attacked is unhook everything from not only unplug everything, but unhook everything from your Wi-Fi, and then have your IT work to remove the ransomware from your systems. But while that's the case, you can always use a separate computer or a separate iPad if you need to, so that you can log into your EHR system, for example, because your EHR system is not only giving you the information in real time, it's backing everything up. So if you've been attacked and you can't get to the real-time information, you at least have the backup data, and you can go to the backup data while your IT is trying to get that ransomware cleared out and getting you back up to normal workflow again. So instead of paying, what I would do is have your IT come in immediately, work to get that ransomware off, work to get you set up, and in the meantime, set you up with the backup data. Now, I have had practices where they've had to use the backup data and they're like, we're glad we had this, but backup only backed up to 24 hours ago, so everything we put in yesterday isn't in there. And so they're having to run, in that instance, they're having to run on the most current and available that they do have, but it's better than not having anything at all. And so you basically bring in your IT, they work to get everything off while you're working from backup data. And then once everything's back up and running and the ransomware has been taken off, then you can just transfer the data back over. But that would be really the only option you would have to keep from paying Because the FBI they won't want you to pay. What they want to do is they want to have that cyber attacker continue to try and contact you for it, because that allows them to track and try and find and catch the guy. And so they don't want you to do that. One thing that I did forget to mention, and I'm glad we had this question, is if you've been attacked and the FBI tells you not to pay the ransom, and you know that that it's 500 or more people who were or could have been affected by that ransomware attack, what the FBI will tell you is you're not allowed to report that breach, because if you do, it becomes public knowledge, because HHS OIG makes the breach public. And so a lot of times the FBI will tell you not to report, so that HIPAA requirement of reporting within 60 days goes out the window until the FBI tells you that it's okay to report, and then that 60-day clock starts. So if the investigation takes a year from the time you knew about the breach and they tell you not to report, then when you do finally report, you're not violating any HIPAA regulations by reporting late because a federal agency told you not to. Okay, because they may not want the individual who attacked you to know that you're even aware of the breach. Okay, so that's what I would say is, to get back to your question, that's what I would say is to have IT work to get that ransomware attack off, and then work from your backup data until everything has been cleared and you're good to go.
Gotcha. Yeah, that safe harbor information is good to know, because
Yep.
otherwise you'd be in violation of HIPAA and then face whatever penalties and so forth are involved on that side. But whether it's FBI or any federal agency, I guess that gives you the safety net.
Yeah, it's nice to go to HHS and say, hey, I didn't report this a
Yeah.
year ago, and here's why. The FBI, your partner federal agency, told me not to report it to you. So,
Mhm.
yep.
Thank you.
Feel free. I'll give it a couple more seconds. I don't see any more messages at the moment. Okay, well, this will conclude today's webinar. And I would like to thank everybody for attending, and a big thank you to Kyle for his informative presentation. We would also like to invite everybody to register for our 2023 Medicare update on Wednesday, February 22nd. For more details, feel free to visit our website at mgmastl.org. And we hope that everybody has a great day. This concludes our seminar. Thank you.